Namaste, Dr. Arpitha. Good evening. I am Srinivas Reddy from Telangana Today. Thank you for
Good evening.
accepting our request for talking on this. I would like you to tell our readers about the conjunctivitis that is prevalent in Hyderabad and India nowadays, right now, and also about the difference between the general conjunctivitis and what you call the pink eye. Generally, what we know as a common man is that we talk about red eye, and now we are thinking about pink eye, and then subsequently precautions to be taken. So, what exactly is the conjunctivitis, Dr. Arpitha?
Yeah, conjunctivitis is a thin layer which is in front of the eye, on the white part of the eye, which is called the sclera. On it is a transparent layer. It's called the conjunctiva. When it is inflamed, it is called as conjunctivitis. So the pink eye or the red eye is the same. It is called mainly by the virus. It is mainly adenovirus, and it is caused by several other bacteria also. So due to the monsoons, especially in monsoons, due to the weather conditions, climatic conditions, due to the moisture, these viruses will prevail and causes eye infections. So what happens is usually patients start with the redness and swelling of the eye, watery discharge and grittiness and irritation of the eye, and they also present with itching and burning sensation. They also present with the crusting of the lashes and discharge. Mainly they starting initially present with watery discharge, and then secondary bacterial infections also can occur in the eye. So when they have to see a doctor, if they have any eye conditions, and also if they have any pain in the eye, or light or blurred vision, or redness in the eye, or if the worsening of the present symptoms. Especially now, patients with weakened immune system or pre-existing eye conditions, like if suppose patients are on cancer therapy, or if the patients on high steroids, they are more prone at risk. So these patients are have to see the doctor immediately and get the treatment. Self-treatment is contraindicated because patients will usually take up steroids on their own, and this one will worsen the condition. So I request all the patients to seek the doctor and take the medication and precautions. The precautions would be like avoid crowded places, sanitize your hands frequently, clean your eyes with sterile cloth, stay away from the infected patients, and also cover and when they are having cough or sneezes, when they are in the viral flu, ask them to prevent the spread of the germs by covering their nose or with a kerchief or with the elbows. And also social distancing is important. These patients should avoid skip swimming pool during the conjunctivitis phase, and also avoid wearing contact lenses if you have a pink eye.
What exactly, when should the patient, when will the patient know that he is affected with conjunctivitis? At what stage they should be approached the doctor?
Yes. So usually, initially, the patient will have little gritty sensation and watering of the eyes. So that is the initial presentation of the symptom. So eventually, in a day or two, they will turn up the lid red eye and also the lid edema. Once there is blurring of vision, or if there is severe pain in the eye, they have to report to the doctor immediately.
In such time, do you think they can go to any medical shop and take some ointment or anything across the counter? Over the counter medicines are available. Do you think they can take some precautions by using some ointment or something like that?
Over the counter medication is very dangerous because most of the eye drops contain steroids. So this steroid should be avoided in this pink eye or the conjunctivitis, because these steroids will flare up the infection and cause worsening of the symptoms. So over the counter drugs should be avoided. Please consult your doctor and then only seek the medication.
And doctor, you were talking about cancer patients and this thing. Who are the most vulnerable groups for this sort of a conjunctivitis?
Especially when they are in an immunosuppressed state or immunocompromised state, such as patients are on cancer therapy, or if they are on chemotherapy, or patients are on high dose of steroids, long-term steroids, or pregnant women, they should be very careful, because usually this viral conjunctivitis is self-limiting. Within 3 to 5 days, it resolves. But we are seeing patients with immunosuppressed or immunocompromised stage. The patients are getting bad, and this resolution of the conjunctivitis is taking little longer compared to that of normal.
Okay. How many cases are reported in Hyderabad now, madam, in this season?
Season in Telangana, like we are seeing more than 400 cases.
400 cases a day.
Yes, yes.
Thank you so much, Dr. Arpitha, and you've been so kind to us, and I hope this information, what you have given, is useful to our viewers also. Thank you so much. Have a nice day.
Thank you. Thank you.